Ladies and gentlemen, there comes a point in life when wisdom must replace habit. When the same things that once protected us begin to quietly put us at risk. After age 70, the human body does not respond the same way it once did, and nowhere is this more apparent than in the world of hospital testing. For decades, we've been taught that more testing means better care. That early detection always saves lives, that vigilance is our best defense. But the truth, my friends, is more complex. In medicine, as in life, more is not always better. Sometimes, more means harm. I want to take you on a journey tonight, not through abstract science, but through real human stories. Stories that remind us that behind every test result, every diagnosis, and every hospital visit, there is a life. A person with fears, dreams, and a body that deserves compassion more than mechanical intervention. Let me start with someone I'll never forget. Her name was Margaret. At 74, she was vibrant. She walked every morning, tended her garden, and loved baking pies for her grandchildren. But one winter, after a routine checkup, her doctor recommended a series of tests. Just to be safe, he said. A heart stress test, a CT scan, a few blood panels. None of these were prompted by symptoms, only by age and precaution. The first test led to the next, which led to another. Within a few weeks, she found herself inside a hospital bed, waiting for a biopsy on a suspicious shadow that had appeared on her scan. That shadow turned out to be nothing. A harmless age-related change, but the procedure led to an infection, the infection to weakness, and the weakness to a slow, painful decline. Margaret didn't die of disease. She died from the consequences of too much testing. What happened to Margaret is not rare. In fact, it's part of a silent epidemic spreading through modern healthcare, the overtesting of older adults. Each year, millions of seniors undergo hospital-based screenings that have no proven benefit past a certain age, but carry very real risks. This is not about negligence. It's about a well-intentioned system that has not yet caught up with the science of aging. And it's about our deep cultural fear of missing something. A fear that drives both doctors and patients to chase answers that may not exist. So tonight, I want to explore 5 hospital tests that, after age 70, can harm instead of help. These are not inherently bad tests. They've saved countless lives. But beyond a certain age, the balance between risk and benefit begins to shift. The body becomes more fragile, healing slower, reacting differently. What used to be a simple test in midlife can become a dangerous cascade later on. The first test I want to talk about is one that nearly every older adult has encountered: the cardiac stress test. It's a staple of hospital cardiology. You walk on a treadmill while your heart rhythm is monitored to detect blockages or abnormalities. For younger adults with clear symptoms, it can be life-saving. But for those over 70 without chest pain, the evidence tells a different story. When you put an aging heart under artificial stress, especially one already coping with high blood pressure, medications, or mild arrhythmias, you risk triggering exactly what the test is designed to prevent: a cardiac event. I remember a patient named Harold. He was 79, a retired carpenter who came in feeling a little tired lately. His physician ordered a stress test just to be thorough. Halfway through the treadmill phase, Harold developed chest pain and collapsed. He survived, barely. The irony is that, later, his cardiologist found no major blockage at all. Harold's heart had been stable. It was the test itself that pushed him over the edge. The question we must ask is simple but uncomfortable: when does screening stop being protection and start becoming provocation? After 70, the heart does not need to be challenged to prove its worth. It needs to be respected for what it has already endured. Now let's talk about another common one: the colonoscopy. Colon cancer screening saves lives. That's true. But past 75, the risks of the procedure often outweigh its benefits. A colonoscopy is not just a camera, it's sedation, bowel prep, and sometimes biopsy or polyp removal. For a younger person, the colon recovers easily. But for older adults, the story changes. The bowel wall becomes thinner, the hydration balance more delicate, the immune response slower. One of my dearest patients, Eleanor, was 82 when her doctor urged her to stay proactive with another colonoscopy. She had no symptoms, no family history, and her last test 5 years earlier was perfectly clear. But she wanted to be responsible. During the procedure, a small tear in her colon led to a severe infection. She spent months recovering in a rehabilitation unit, never quite regaining her strength. What was meant to extend her life ended up diminishing its quality. Science supports what her story reveals. Studies from Harvard and the Mayo Clinic show that, for people over 75, the probability of benefit from colon cancer screening drops dramatically, while the risk of complications rises steeply. We often quote statistics about how many cancers colonoscopy can catch, but rarely do we discuss the hidden toll. The lives quietly changed or lost from bleeding, perforations, or sedation reactions. The third test, and perhaps one of the most misunderstood, is the CT scan, especially when done just to check. In hospitals, CT imaging has become a reflex. A headache, scan. Mild chest discomfort, scan. A tiny cough, scan. But each of these scans exposes the body to ionizing radiation, and that risk accumulates. Older adults, whose DNA repair systems are already less efficient, are particularly vulnerable to radiation-induced cell damage. I once met a man named David, 76 years old, who had undergone 8 CT scans in a single year, all from different specialists, none of whom coordinated with each other. Each scan showed minor age-related changes, small lung nodules, tiny kidney cysts, which led to even more testing. By the end of that year, he was diagnosed with scanxiety, a term we use for the psychological distress that follows repeated imaging. He told me, "Doctor, I feel like a patient even when I'm not sick." And that broke my heart, because David wasn't afraid of dying. He was afraid of discovering something that might never matter. The fourth test is one that's often overlooked: the bone density scan, or DECA scan. It's a wonderful tool when used properly, especially for identifying osteoporosis in postmenopausal women. But here's the problem: once you're over 75, a new DXA result rarely changes treatment. The body's bone metabolism slows, and medications to improve bone density carry their own risks: fractures of the jaw, kidney issues, gastrointestinal problems. Yet hospitals continue to order these scans yearly, even when the previous results were stable. A woman I once counseled, named Ruth, was 78 when her scan showed slight bone thinning. She was prescribed a strong bisphosphonate drug that caused severe esophageal irritation and chronic pain. The irony? Her fracture risk had not actually increased since her previous scan. She traded comfort for numbers, and numbers for anxiety. Sometimes the best medicine, especially in later life, is not more data, but more wisdom. And finally, one of the most controversial, the PSA test for prostate cancer in men. The prostate-specific antigen test is simple, but the consequences can be anything but. After 70, prostate cells naturally become more active, and PSA levels can rise without cancer being present. Yet a single elevated result often triggers biopsies, surgery, or radiation interventions that can leave older men incontinent or impotent, sometimes for cancers so slow growing they would never have caused harm. I remember Thomas, a 73-year-old professor who came in because his PSA had jumped a little. He felt perfectly fine, but his anxiety led him down a spiral of tests and biopsies, which led to a diagnosis of low-grade cancer, the kind that's often better watched than treated. He couldn't bear the uncertainty, so he chose surgery. The procedure went well, but the aftermath left him with lifelong complications. He told me once, "I lost my sense of manhood to a cancer that might never have touched me." What these 5 tests have in common is not that they are evil or unnecessary. It's that they were developed for a different biological context. For bodies that recover quickly, that tolerate stress, that bounce back. But the aging body is not a broken version of a younger one, it's a transformed ecosystem. Its priorities are different. Its healing pathways slower but wiser. What it needs is not more intrusion, but more discernment. And here lies the deeper problem. Our healthcare system is built on fear. Fear of missing something, fear of being blamed, fear of disease itself. Doctors are trained to, or rule out everything. And patients are conditioned to believe that every new scan, every new test, is a sign of good care. But when fear drives medicine, wisdom disappears. When I ask older adults what they want most from their later years, they don't say, to live forever. They say, to live well, to stay clear-headed, mobile, independent, to enjoy the laughter of their families without endless appointments and hospital visits. Yet too often, our pursuit of safety steals that very quality of life. And the next part will continue seamlessly from here, exploring why overtesting happens neurologically, the psychology of medical anxiety, and how seniors can reclaim autonomy from unnecessary diagnostics. And end with a moving, inspirational close. But if we truly want to change the culture of care after 70, we must first understand why overtesting happens, not just medically, but psychologically, culturally, and neurologically. You see, the human brain is wired to seek certainty. Uncertainty triggers the same survival circuits that our ancestors once used to detect danger in the wild. When we don't know what's happening inside our body, that uncertainty feels like a threat. So we look for information, we scan, we test, we measure. Each result offers a temporary sense of relief, a neural hit of dopamine that says, "You're safe now." But when the next ache, twinge, or sleepless night comes, the cycle repeats. The hospital becomes not a place of healing, but a temple of reassurance. And for doctors, the psychology is equally powerful. Modern medicine rewards certainty. Every guideline, every malpractice policy, every institutional protocol quietly whispers, "Do not miss anything." So even when a test is unlikely to help, ordering it feels safer than not ordering it. We have built a system where doing more is easier than doing less. Even when doing less is wiser. But here's the irony: the brain, after 70, thrives on calm predictability, not medical chaos. Chronic stress from repeated testing and hospital visits increases cortisol levels, weakens the immune system, and accelerates cognitive decline. I've seen patients who were physically stable but mentally exhausted, worn down not by illness, but by investigation. They lived in a state of medical limbo, where every result brought more questions instead of peace. I'll never forget one man, Joseph, 81 years old, a former pilot. He told me, "I feel like I'm being slowly dismantled, one test at a time." He'd had so many scans, scopes, and biopsies that he no longer recognized his own reflection in the medical reports. "I used to be a person," he said quietly, "now I'm a collection of results." That sentence stayed with me, because it captures something profound about aging and modern healthcare. The moment we stop treating people as whole beings and start treating them as data points, we lose the art of medicine. Ladies and gentlemen, we need a new kind of wisdom, one that honors the biology of aging, the neuroscience of fear, and the deep human need for dignity. After 70, medicine should shift its focus from searching for disease to protecting vitality. That means asking different questions. Instead of, "What else can we test?" we should ask, "What do you want from your next 10 years?" Instead of, "How can we find every possible problem?" we should ask, "How can we help your body feel safe, balanced, and strong?" And yet, many older adults tell me they feel powerless in hospitals, rushed, confused, and overwhelmed by complex choices. So how do we reclaim that power? It begins with conversation, honest, Human, compassionate dialogue between patient and doctor. The best medical decisions are made not in fear, but in partnership. Imagine this: you're 75, and your doctor suggests another test. Before agreeing, you ask 3 simple questions, not confrontational, just thoughtful. Will this test change how we treat me? What are the risks if we don't do it? What are the possible harms if we do? Those 3 questions can transform the entire dynamic. They remind your doctor that you are not a passive subject of medicine. You are its purpose. You are the reason the system exists. There's also something deeper here, something the neuroscience of aging has been showing us. After 70, the brain becomes more sensitive to emotional context. Older adults process empathy and trust more powerfully than younger ones. This means that how a doctor speaks, the tone, the reassurance, the eye contact, these have more physiological impact than we realize. Compassion literally changes brain chemistry. It lowers stress hormones, stabilizes the autonomic nervous system, and supports immune resilience. So when we replace compassion with protocol, when we substitute connection with computer screens, we are not just depersonalizing medicine, we are weakening the body's own healing potential. Let me share a story that changed how I see aging. A woman named Lydia, 87, once told me, "I'm not afraid of dying. I'm afraid of dying inside a machine." She had spent years being poked, scanned, and prodded, always told that something might be wrong. But one day she said, "No more. I just want to live the days I have." She stopped most of her hospital visits, focused on gentle walks, good food, laughter, and sleep. 2 years later, she was stronger, calmer, and, by every measure that truly matters, healthier. It reminded me that health is not the absence of disease, it is the presence of balance. And balance cannot be measured by a test. But change won't come easily. Hospitals are busy, systems are rigid, and fear is profitable. Every unnecessary test brings revenue, every complication another billing code. Yet the most revolutionary act in healthcare may be the simplest one: saying no. No, I don't need another scan just because it's been a year. No, I don't need another blood panel when I feel well. No, I don't need to be searched for sickness when I'm already living in wellness. There is a quiet courage in that kind of no. The courage to trust your own body again. And for families, that courage is often hardest. Watching an aging parent or partner, we think that doing everything means loving them more. But sometimes, love means restraint. Love means protecting them from the very system that wants to protect them too much. Love means saying, "Let's focus on your joy, not your numbers." The neuroscience of aging tells us that meaning, a sense of purpose, connection, and autonomy, is more protective than any medical test. Studies on longevity consistently show that seniors who feel empowered and socially connected live longer, even with chronic illnesses, than those who feel medically managed but emotionally detached. The body thrives on agency. The mind thrives on peace. So what would a truly wise healthcare system look like for those over 70? It would be one where tests are used like poetry, sparingly, meaningfully, with deep respect for context. It would be one where physicians are trained to see aging not as decline, but as transformation. And it would be one where every older adult leaves an appointment feeling calmer than when they entered, not burdened by new fears, but lifted by understanding. There is a phrase I often think about: we grow older, not weaker, just different. The older heart beats more slowly, but more wisely. The older brain processes more slowly, but connects more deeply. The older immune system may respond less aggressively, but more strategically. We must stop treating this evolution as failure. It is not failure. It is adaptation. When we design medicine around youth, we create harm. When we design it around age, we create grace. Margaret, Harold, Eleanor, David, Ruth, Thomas. Their stories remind us that healing is not about doing everything possible. but about doing what is right for the body in front of us. They remind us that tests can be both tools and traps. They remind us that medicine, when stripped of empathy, becomes mechanics, but when infused with understanding, becomes art. And so I stand before you tonight with a simple invitation. Not to fear hospitals, not to reject science, but to embrace discernment, to ask better questions, to choose peace over panic, to remember that the goal of medicine is not immortality, it is dignity. Ladies and gentlemen, if you are over 70, or if you love someone who is, I want you to carry this truth. You have the right to say no. You have the right to pause before every test and ask, will this help me live better, or just longer? You have the right to trust the wisdom of your years. Because after 70, the greatest test of all is not medical, it is human. It is the test of knowing when enough is enough, when peace is the best prescription, and when simply being alive, aware, and grateful is the most powerful form of healing there is. And maybe, just maybe, the future of medicine begins not in a lab or a hospital, but in that quiet moment when an older person looks up and says, with courage and calm, I'm okay. Let's just live. Thank you.